Time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hello, pet lovers. Dr. Bob here. I'm happy to be back with PetSylvania on a glorious Saturday. And Buckeyes play tonight. I always try to keep you posted on what the Buckeyes are doing. They play Indiana at Indiana. The word is there will be more Buckeye fans in Bloomington than there will be Indiana fans. Let's hope that's true. I'd like to again thank Elanco, makers of Trifexis, your once-a-month heartworm and flea control pill, and Comfortis, flea control once a month in a pill form as well, for being my sponsor, and of course, Sylvania Vet, my office. We are a regional veterinary resource available 24/7 for everything from nail trims in our grooming to intensive care with our overnight 24-hour staff. Why look for the closest vet when the best vet is just down the street? The Better Business Bureau gives us an A+ rating, and that's always reassuring for the public as you're looking for a veterinarian. I'd like to welcome Dr. Crystal Davis to our staff. Crystal is a graduate of the University of Edinburgh in Scotland, grew up in eastern Michigan, attended Adrian, and then morphed into a veterinary school in Europe. And we're very excited to have her back. She in joining our staff. She'll be there on Monday, the 15th of October, and hopefully for a very long time. She has a very strong interest in cats, is going to be integral in our initiation of the cat-friendly practice designation that we carry, the only practice in Northwest Ohio that carries the cat-friendly practice designation from the American Association of Feline Practitioners. If you have cats, you want to go to a practice that has this designation. We treat and handle your cats far differently than in a lot of other practices. Our practice has separate cat hospital within the building, separate cat exam rooms, and a separate cat waiting area, all designed to make the visit less stressful for your cat. So we'll get to keep you posted as to how that project is going and what you can expect to see and learn from us concerning that. Last week we had a little contest, and Dave Nicholson, one of my great listeners, won the prize for knowing month and year that Sylvania Vet was established. That was March of 1974. So David, come on into the office, 4801 North Holland, Sylvania, at the corner of Haroon and Holland, Sylvania, and pick up your prize. It's waiting for you at the front desk. We have a really fun event going on in November with as a fundraiser. We have something you may not know is Sylvania Vet has a charitable foundation. It's called the Memories Live On Animal Foundation, and on the property is a memorial garden that is one of the methods that we use to fund our memorial fund. And one of the things that we do is that we give a scholarship to a deserving veterinary student at Ohio State, and the cost of veterinary education today is with room, board, tuition, everything that you might associate with going to school, professional school for 4 years, is estimated to cost a student $250,000. We're actually pretty excited that our Memories Live On Animal Foundation can help in a very small way by giving a $2,500 scholarship to one of the vet students. On Wednesday, November the 7th, from 5 o'clock to 9 o'clock, BW3s on Central Avenue is going to host us and any of our guests that want to come. And whatever food you order, they are going to donate to the Memories Live On Animal Foundation 10% of that ticket. So we greatly appreciate the generosity of BW3s. We have tickets at the office. They're no cost, of course. You just come on in, pick them up. You pick one up for anybody that's going to accompany with you. And when you get there, give them to the wait staff, and then they'll keep track of that. And then they'll give a check to us. So you're going to be able to eat some great BW3 wings and other food and help our Memories Live On Animal Foundation. So it's a win-win, that's for sure. You can come in the office and pick those up anytime. A lot of times clients come in and their dog has a wound and they'll tell me, I treated it at home. I used some hydrogen peroxide on it. Generally, I would tell you that I don't think that's a very good idea, and I know it looks great. You got a wound that's got a little bit of blood on it and you pour some hydrogen peroxide on there and it's bubbling up and it really looks like it must be doing something. But you know what it's really doing? It's damaging the cells of your of the exposed tissue. What does hydrogen peroxide do when you put it on your hair? It bleaches it, right? Well, it does the same thing. It blanches the healthy tissue underneath the wound and causes some of those cells to die. It's just not a good idea. So what do you do if your animal gets a wound and you want to do some care? Well, what I would do is I'd cleanse it with soap and water, rinse it thoroughly, get it nice and dry, put some polysporin or some bacitracin on it, and then try to cover it up with a clean cloth or some roll gauze, anything you might have at home. And then if you feel it needs to come in, then definitely call and get something scheduled, either from an emergency, because we're going to be there 24 hours a day, 7 days a week, and we can see that laceration at 2 a.m. if need be. So let's say you're watching the Tigers game last night, and you're up much later than you should be, and they lose, and you're distraught, and you kick your dog out the door, and it runs into the porch furniture and cuts its leg, and it's bleeding. What are you going to do? Well, you're going to cover it up with a cloth. Maybe you're going to clean it, maybe you're not, but you're going to call us, and then you're going to come on in, and you're going to have us take care of it, and we'll be able to do that. We have a doctor on call 24/7. We see this time of year, but year-round we see, and for some reason we see it a lot in golden retrievers. We see a lesion on the skin that's called a hot spot. We call it a hot spot, and a hot spot can be real moist and sticky with infection and bacteria. Generally, it smells, and it's got hair stuck to it and everything. And it's a form of just moist pyoderma. Pyoderma being a fancy name for infected skin. How do you handle a hot spot at home? A lot of times they do need to be seen because the dog just won't leave them alone, and they literally can create this wound from 0 to 60 in a very few minutes. And so the key is to get the dog to leave them alone. We usually need to use some steroids, some oral antibiotics. It needs to be clipped up, it needs to be cleansed, and then topical antibiotic ointment on it, maybe with a little bit of steroid. We use a product called Tri-Top. It's really a great product. It has topical anesthetic, it has a little bit of steroid, it has some antibiotic in it, and we use it a lot on a hot spot. But you have to be gentle with these because they are really tender. It's kind of like messing around with a really bad case of sunburn. You got to be very gentle when you handle that. Oftentimes get asked, how often can I bathe my dog and what should I use? Well, my answer is that it does depend a little bit on the hair coat. If you have a Siberian Husky, you're not going to bathe that animal as often as you would if you have a poodle or a Jack Russell, because that long, deep hair coat with the double hair coat, it's going to take forever to get it rinsed. It's going to take forever to get it dry, and particularly as the colder weather comes, that can be an issue. But when your dog needs a bath, you bathe it, and if it smells or if it's filthy and it needs a bath, you give it a bath. And if that's 3 days in a row, so be it. A lot of times that happens a lot with puppies that like to go out and just dig in the garden and make a filthy mess out of themselves. So you got to bathe them. If it's not necessary, you don't do it. A good dog shampoo is really what you should use. Do not use Johnson's Baby shampoo or any human shampoo. It's too drying. Time to take a break, and we'll be back on the other side. Just another couple thoughts with you on bathing. A shampoo that I like a lot, and I think it does a great job for dogs. It has a built-in conditioner. It's called Plum Silky, and we sell a lot of Plum Silky. We use it in our grooming facility as well because it has this just a nice little plummy odor, a nice little residual odor, and it gets them real clean and makes the hair coat very soft. So we like Plum Silky a lot for general bathing purposes. I have a dog that we care for, and about 6 months ago, she developed glaucoma in her eye. Glaucoma is an increased pressure on the inside inside of in pressure on the inside of the eye. And it's very painful when it occurs. There's usually a loss of vision associated with it. And in this case, we were unable to get the glaucoma under control, and we ended up having to remove the eye because we need to eliminate the pain. So we now monitor the other dog, and was doing great. So we backed off a treatment a little bit. Lo and behold, in the dog comes with glaucoma in its remaining eye, and very aggressively reduced the pressure in the inside of the eye, got it under control, got it back on the medication, checked it here just today, and its pressures are staying under control, but we don't think it's seeing very well. So we're going to have to. We hope that the dog adjusts and adapts to the blindness or near blindness that exists. But I do have a few dogs that, over the years, because of glaucoma, we've lost vision in both eyes, and we've actually lost both eyes. And as a result, the dogs really adapt pretty well, and it's been gradual, and they've been able to deal with their blindness. And it's not much different than a dog that has really severe bilateral cataracts from, say, having diabetes. They're blind as well, and they get around pretty well. So it's not a life-ending trauma. It's a pretty emotional trauma, though, for the owner to think that their dog has lost its eyes, not only lost its vision but lost its eyes. So we use an instrument called a tonopen, and in certain breeds of dogs, the Cocker Spaniels, Lhasa Apsos, Shih Tzus, many of those dogs are predisposed to glaucoma. So we test pretty regularly if we see anything in an eye on an exam that looks like it could be glaucoma. A really red eye, a painful eye, a cloudy clear portion, which is called the cornea, a widely dilated pupil are all clinical signs associated with glaucoma. If you see something like that in your dog, I would not hesitate. That's a true emergency, and you need to come in and see the veterinarian, even if you're seeing that, at midnight or whenever. So that glaucoma is one of the things that we consider a true emergency. Puppy development class for dogs, under 5 months, in some cases only under 4 months. Really, the importance of that cannot be overemphasized. It's even if you have another dog at home, which is better than nothing at home, or a neighbor dog. It's a socialization experience. It's a socialization experience for the dog to get used to being out of the house in a safe environment, to be with other people that have have pets as well. And certainly the dogs can socialize with one another. And in a good puppy development class, puppies are taught some very, very basic obedience, but they're also exposed to a lot of things. They're exposed to stairways. They're exposed to clanging pans and noises and doorbells and all kinds of things, which in a safe environment with you there to reassure it so that it learns not to be freaked out, which then also, reminds me that when you bring that new puppy or that new kitten home, you should be messing around with its feet and its ears and its lips and its mouth and scratching its back and using a comb and a brush on them and handling their feet so that they get used to having their nails trimmed. Use a lot of positive reinforcement, a lot of positive rewards as you do this stuff. Little pieces of Cheerio, peanut butter, put some peanut butter on some popsicle sticks and put them in the freezer, and then bring that out. And while you're doing these things like playing with the feet or playing with the ears or lifting the lip and getting them used to having your fingers in their mouth, they can be licking on the peanut butter popsicle stick, and they'll have positive feelings about all those procedures, so that when it's necessary, when they're a little older, the dog will be more, or the cat will be more willing to allow you to do that. You don't ever want like a nail trim to be a real war when it comes down to getting things done. And that seems to be the hardest thing, and why we do an awful lot of nail trims, because people have had bad experiences with nail trims at home. I've got a question here and from Steve, and Steve has asked me, is it good to take food and bones away from your dog so they get used to it? You have to be very careful with that. And I do think that overall it's a pretty good idea. We don't want dogs to be guarding and owning their possessions. And quite frankly, whether it's a bone or it's food or it's a chew toy, it's something that, the dog should come and you should ask them to give it to you, and they should willingly do that. And so that means you should possess all these things. That's one of the advantages, I think, of feeding specific meal times and getting the dog used to eating that, so that they know when it's meal time. You make them sit to earn it, and then you put it down, and you're controlling the situation. All their chew toys and play toys are theirs as well. But I want to counsel you that if you have a dog that whether it starts as a puppy, or you've adopted an older dog, or your older dog is just getting a little bit crotchety, and they start to be possessive or protective, I want you to be really careful in that scenario. I don't want anybody putting themselves at risk. A situation like that is what I would do is I would have a leash on my dog in the house, so that you have a handle and you can get away. And then pick your fights. If they pick up a piece of the newspaper and they're back under the coffee table chewing on that piece of newspaper, it might not be worth going to the mat to try to take that away from them. Yeah. On the other hand, if it's your brand new pair of Florsheims that you just paid $150, you better go get that. We get a number of calls about the dog having chewed the cell phone, and what's the worry there? Have they ingested anything bad? No, you've probably just lost a couple $100. In most cases. Of course, we don't want to swallow in a battery. That could be pretty harmful. A recent journal article talked about the American Animal Hospital Association and the American Veterinary Medical Association. Both those organizations denounced the feeding of raw food diets, and that is all foods that are raw. It doesn't matter if they come out of the store frozen. It doesn't matter if you go to the meat department and you buy the liver, or you buy the chicken, or you buy the ground beef. It's not appropriate to feed. There are over 50 diseases that can be transmitted and passed in the stool of the dog. So it's not just the worry about the dog getting the disease, whether it be salmonella or listeria or giardia or any of those other things. It has to do with the potential transmission to humans. And so it's again, the American Association of Feline Practitioners and the American Association of Public Health Veterinarians both support that position. It's just not a good idea, and there's no rational reason to feed raw food. If you want to learn more about this, you can go to the AAHA's website, and it's healthypet.org, and you can see their position paper on this. But it's a well thought out position paper, and I think there's a lot of great science behind these decisions. And until raw foods are determined to be able to sterilize them so that they are free of disease, it should be avoided. It's time to break again. Please send me questions. I really appreciate it when Steve sent me his question. So that was great. It's now time to talk a little bit about the events that are going to be happening that involve Sylvania Vet. And so the first one is Friday, the October the 19th, is the Cool Cat Strut, which is major fundraiser for Paws and Whiskers, which is the only no-kill, cat-only shelter in Northwest Ohio. We are strong advocates for Paws and Whiskers, and strongly encourage you to attend the Cool Cat Strut. You will have a great time. You can get information on the Cool Cat Strut at 419-536-1914 or on the Cool Cat Strut website at www.coolcatstrut.com. And you dress up for Halloween, have a great time. There's going to be food. There's going to be music by Techno Sound. So there's going to be dancing. There's going to be a cash bar with ginger ale and other things like that. Raffles, door prizes, an auction, dinner, just fun. So we want to encourage you to come to the Cool Cat Strut. On Sunday, the 21st, is the Downtown Sylvania Fall Festival, an annual event, which is just great. And it's a lot of fun. And if it's a nice, crisp fall day, we're there from 9 to 3. You're going to have the best time. There's going to be a parade that starts about 1 o'clock, and the bands there'll be bands, there'll be fire equipment. There'll be floats, and Sylvania Vet's going to have a float. We're going to have Lola there as Snow White, and then she's going to have her 7 dwarf puppies, and the Wicked Witch is going to be there. We're going to have and you're welcome to bring your dog, dress it for Halloween, and jump in and be part of the parade. Have a really good time, and then stop by our booth because we're going to have a lot of fun there, and we're going to have gifts and things to give away, and we'll of course be talking about pet care. So we'll talk more about that next week. On November the 18th, we have an adopt-a-thon, and that's happening from noon to 3 at Sylvania Vet in the Learning Center and our daycare area. And we would certainly encourage you, if you're looking, we'll have area rescues there with animals looking for forever homes, and that'll be a great event. And then Santa Pet Pictures are going to happen on Sunday, December the 2nd from 10 until 2 o'clock in the afternoon. And so we have studio quality pictures of Santa with your pet, and you can include the family, you can include the kids, you can we've had people bring in litters of puppies and mom and arms full of animals, and Santa loves it and doesn't mind at all and has just a really great time. The cost is going to be $22, and it'll be for a 5x7 plus 4 wallets, and then there'll be other options to buy as well. So that's kind of a rundown of our events. The quiz for today: name our new doctor and where she went to school. And hopefully you can let me know at Dr. Bob at SylvaniaVet.com. Thank you, Elanco. Thank you, Sylvania Vet. Come see Sylvania Vet anytime. Take a tour, 4801 Holland, Sylvania at Haroon, www.sylvaniavet.com, 419-885-4421. There's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.